I'm Eleanor Hill. I work in the Public Health Directorate of Stockport PCT and have a particular remit around wellbeing and around workforce development, as well as being very involved in development of our lifestyle services. I think for me it was very much about finding a tool on which you could build things into contracts and talk in terms of very specifics about the way the service has to change and what it's got to do and what's the difference in people's day-to-day jobs. It's been very handy in Stockport having a team that's linked commissioner and provider. For example, we did a training with our health chat with the wheelchair equipment services, with their whole team.
Yep.
So we discussed in the morning all the issues around making every contact count and who was having conversations with people and when were they having them and what was the difficulty of bringing up things. But then in the afternoon we were also able to think, with that particular training, we had a secondary workshop looking at, well, what does it mean for them and what are they going to change? And some of the challenges that threw up for us as commissioner were really important, about the fact, for example, a lot of people in that service are housebound or very lacking in mobility, and our service doesn't supply them with a service because we're not going into people's homes. And so it brought a challenge, a very concrete challenge back for us to then build into a service specification. Right. Likewise, it helps you think, okay, well, which staff are out there having the conversations with the members of the public, and therefore how do you build into a contract this specification that these staff need this level of competence. Another example would be through our alcohol strategy group, where we've been very interested. We've got a big problem, as most areas of the country, with alcohol. We're trying to boost capacity across the system, and it was quite challenging initially for people to understand, well, who needs what sort of training. The competence framework has been a really simple way of being able to demonstrate that actually everybody at the bottom of the pyramid needs the simplest level of training, and as you get further up or you get into more complex areas of the work, then you need more training. But without training, we've been able to say, well, this one is the one that everybody needs. It's not sufficient to do brief interventions or to deal with complicated alcohol, but it means all your staff can have a confident conversation on the issue. And I think for my colleagues that's been really helpful for them to try and think about the way they map their training provision and where the gaps and the needs are. I'd like to see it getting into contracts so that there's a much clearer awareness of between both providers and commissioners of what it is we're wanting people to do in terms of public health, and the limits of that ambition, if you like, that we're not expecting every frontline member of staff to be a public health expert. We're just expecting them to know that there are certain issues which are really important for people's health, and they should be finding out the people with those issues and do they want to change, and if they do want to change, put them in touch with services. The services obviously need higher levels of skills because they're working more intensely in supporting people through a behaviour change, but the frontline staff making every contact count is simply to gather people in and get them to come for help because it's really important.
So it becomes an organisational message?
Yes.
Okay.
Yes. I think getting the social care part of the health and social care workforce to take it on board will be more challenging, and it's about finding their reasons and the bits of their job where it's going to make it easier and why it's going to reduce their workload or make their workload simpler, and seeing it as part of their duty of care. There's huge potential, and I think to some extent there's willingness, but it's about finding the practical steps that'll make it feel comfortable and not overwhelm people at a time when they're feeling their pay and their benefits are being cut while their hours are being extended, and along comes public health and says do this as well. We're really trying to say no, it's not as well, it's instead of, and it's simple and easy, and it's just like talking to your friends.
That's great. Thanks very much for your time. Thank you.